Psychology, Sleep Disorders from a Biopsychosocial Perspective, Brandon McMillan. Introduction. Sleep disorders are diseases that make it hard for a person to sleep, which can make them less functional during the day. A lot of people have trouble sleeping and it can hurt their mental and physical health. A lot of people also have sleep disorders like insomnia, sleep apnea, restless leg syndrome, and narcolepsy. People who have trouble sleeping are more likely to have high blood pressure, obesity, diabetes, heart disease, and immune systems problems. Not getting enough sleep, because of people who have sleep disorders can make it hard for them to pay attention, think clearly, and feel good. For better quality of life, school success, it is important to check and treat these sleep problems. This is what we'll be getting into today. Overview of biopsychosocial model. The biopsychosocial model asserts that health and sickness are affected by how biological, psychological, and social factors work together. This model gives us a complete way to think about how they and many complicated things that affect a person's health and happiness are affected. Biopsychosocial model stresses how important it is to think about psychological and social factors that affect health, while the biomedical model also only looks at bodily factors. Biopsychosocial model is especially useful in health psychology because it fits with the focus of the field on how health habits and results are complex. Health psychologists can make it more successful, changing and promote overall well-being by taking into action the account that each person's unique biological, psychological, and social situations. Even though the biopsychosocial model is widely accepted, it has been criticized for not being very useful in real life and not having a structured way to collect data. Types of sleep disorders. People with insomnia are having trouble going to sleep, staying asleep, and are waking up too early, which makes it hard for them to function during the day. People with sleep apnea stop breathing during the night, which can lower the oxygen levels and make it hard for them to wake up often. Restless leg syndrome, RLS, is an overwhelming need to move your legs, often followed by unpleasant feelings. It usually happens at night or in the evening. Narcolepsy is a brain disorder that causes people to be too sleepy during the day and fall asleep suddenly. People with this disorder may also experience cataplexy, which is a quick loss of muscle tone. Parasomnias are also a group of sleep illnesses that cause people to move, behave, feel, think, and dream in strange ways while they sleep. This can include sleepwalking, sleep talking, and nightmares. People with circadian rhythm sleep-wake disorders have a sleep-wake pattern that does not match the expected or socially accepted sleep-wake patterns. Example including jet lag, delayed sleep-wake phase disorder. Sleep disorders can be caused by a lot of different things, including genetics, neurochemical changes, stress, anxiety, sadness, and social factors like how people in your culture feel about sleep, and how the world affects you. People who have insomnia often have high levels of alertness, conditioned connections that keep them from sleeping, and bad sleeping related behaviors. Sleep apnea is mostly caused by physical problems with the body that block the upper airway from being overweight, having problems with the face or the skull, or having stuffy noses. Restless leg syndrome is linked to people with the dopamine not getting enough iron and genetics. Hypocretin is a protein that controls the sleep-wake cycle. People who don't have enough of it can develop narcolepsy. It is important to think about the biopsychosocial factors that affect sleep problems to come up with the effective ways to avoid and treat them. Biological factors. Certain sleep problems, like restless leg syndrome and narcolepsy, are more likely to happen if you have certain genes. The neurotransmitters like serotonin, dopamine, and norepinephrine can become out of balance, which can make it hard to sleep and lead to sleeplessness and other problems. When the circadian rhythm, the body's internal clock that controls the sleep-wake cycles, gets thrown off, It can cause several sleep disorders such as delayed sleep-wake phase disorder and jet lag. Medical diseases that cause long-term pain, like arthritis and headache problems, can also make it hard to sleep and make sleeplessness worse. Some problems, like sleep apnea, asthma, and chronic obstruction pulmonary disease, can make it hard to breathe while you sleep. This can cause you to wake up feeling sleepy. Some medicines, like stimulants, sedatives, asthma medicines, decongestants, and beta blockers, can make it hard to sleep. Anxiety and stress can make you hyperaroused and ruminate, which can make it hard to fall asleep and stay asleep. Thinking wrongly about sleep, like overestimating how long it takes you to fall asleep, or picturing terrible things that will happen to you if you don't get enough sleep, can make your sleeplessness worse. People who are depressed often have changes in their sleep habits, like having trouble going to sleep, waking up often, or sleeping too much. Stress about not getting enough sleep can make it harder to fall asleep, which can lead to more problems sleeping. Behaviors that aren't good enough for your sleep, like sleeping at odd times, napping during the day, or staying in bed too long when you're awake, can make your sleeplessness worse. A person's psychological, biological, or social factors can all work together to cause and keep sleep problems going. For the social factors, weather, noise, and temperature, among other things, can have a big effect on the quality of sleep or even lead to sleep problems. Sleep disorders can become normal if people think of sleep as a luxury or a sign of laziness. People from lower socioeconomic groups are often likely to have sleep problems because of things to worry about, with bad living conditions and not having enough easy access to healthcare. Higher socioeconomic classes is a strong driver of sleep health. Some sleep disorders, like shift work sleepers, can be caused by working odd hours or shifts, like nurses or doctors. Less healthy sleep and a higher chance of sleep disorders are linked to being alone and not having many friends. Insomnia and sleep disorders can be made worse by being around crime and other sources of stress in the neighborhood. Current research findings. Some new studies have shown that sleep and several biopsychosocial factors are linked. These studies show that the genetic, psychological, and social factors can affect the quality of sleep. Researchers using a multivariate data-driven methods have found that 5 different sleep biopsychosocial profiles. These profiles show trends that connect sleep problems to certain mental illnesses such as sadness and anxiety. The biopsychosocial model is being used more and more in a professional setting to help diagnose and treat sleep problems. This highlights how important it is to have a full understanding of each patient's unique background. Studies have shown that noise and light pollution in the surroundings areas have a big effect on how well people will sleep. This shows the importance of the social factors in sleep health. Researchers who have looked into how teenagers sleep have found that changes in growth, ties with peers, and school stresses can all cause sleep problems. To solve these problems, a biopsychosocial model is needed. Longitudinal studies of traumatic brain injury, or TBI, show that the way that biology, psychological, and social factors interact changes over time. This changes how well people sleep and how tired they are, showing how important it is to adjust to treatments. Evidence-based treatments. Cognitive behavior therapy for insomnia, or CBTI, is the best way to treat for long-term insomnia because it changes the way people think and act during sleep to improve the quality and the length of their sleep. Over the long run, studies have shown that CBTI is more effective than drug treatments. Patients' sleep quality continues to improve even after therapy ends. Benzodiazepines and non-benzodiazepine sleep aids like Zolopen are the drugs that can be used to treat sleepiness. They may help temporarily, but they also can be more addictive and cause other problems. Melatonin and melatonin receptor agonists are also used to control when you sleep and wake up, especially in people who have problems with their circadian schedule. Making changes to the lifestyle, these practicing good sleep habits, getting regular exercise, and staying away from coffee and screen time before bed can greatly improve the quality of sleep and often suggested along with the other treatments. Some of the patients may benefit from combining the CBTI with drug treatments, especially in the short term. However, it should be done under careful supervision because of the risk of becoming dependent on drugs. Right, assessment instruments overview. Checking for sleep disorders is important for diagnosing, planning treatment, and judging results because it gives useful details about the quality, amount of sleep, trends of sleep. Subjective tools for measuring the sleep include surveys of sleep logs. Objective tools include actigraphy and polysomnography. The choice of which tool to use relies on the study and the clinical questions being asked. Subjective tests like the Pittsburgh Sleep Quality Index, or the PSQI, and the Epworth Sleepless Scale, the ESS, are often used to screen and diagnose sleep problems because they are cheap and easy to use. Objective tests such as the actigraphy and the polysomnography give us thorough information about how sleep works. They are often used to diagnose and elevate treatment, especially when the sleep apnea of narcolepsy is suspected. When choosing the assessment tools, you should think about the sleep problem you're looking at, why you're doing the assessment, and the time, money, and acknowledgement you have, and the knowledge you have access to. Using both subjective and objective measures together can help you get a better picture of the person's sleep habits and finding any differences between how they are slept and how they felt. PSQI. PSQI index is a popular self-report tool that measures the quality and frequency of sleep disorders over the course of a month. It gives a full picture of a person's sleep habits. PSQI is made up of 19 separate questions that, when added together, give a global number between 0 and 21. The 7 scores are the subjective sleep quality, sleep delay, sleep length, regular sleep efficiency, sleep problems, use of sleep medicine, and waking disorder. Studies show that the global PSQI score is 89.6 sensitive and 86.5 specific for telling the difference between good and bad sleepers. A number higher than 5 on the PSQI means poor sleep quality. The PSQI has good internal stability with the Cronbach's alpha values usually above 0.7. This means that it can be used to measure sleep quality accurately across a wide range of groups. This tool has been tested and proved to work in a number of clinical and non-clinical settings. It can therefore be used for the study and clinical practice, especially when looking at sleep problems in mental patients. PSQI can be used for more than just evaluations. It can be used to track the progress of treatment and see how well it measures among working to improve sleep quality. The Epworth Sleepless Scale, ESS, is a self-administered tool that asks people to rate how likely they are to fall asleep in the 8 different scenarios. It measures how sleepy a person is during the day. The ESS is meant to give people an easy and consistent way to measure how sleepy they are and find people who are too sleepy during the day, which could be a sign of a sleep issue or other medical problem. The ESS has 8 questions, and each one is scored from a range of 0, which is no chance of dozing, to 3, which is a high chance of dozing. Total score can be anywhere between 0 to 24. Scientists have found that the ESS is very reliable. Its Cronbach's alpha values are usually between 0.7 and 0.8, which means that the items only measure one thing: afternoon sleepiness. The ESS has been tested on many groups of people, including people with sleep problems, and has shown to be very good at finding people who are too sleepy during the day. This is commonly used in a study and clinical settings to check for sleep problems, track the progress of the treatment, and find out how being sleepy affects the daily life and quality of life. ISI is a 7-item self-report measure that asks about the type, intensity, and effects of sleeplessness over the last 2 weeks. The ISI checks how bad the problems are with falling asleep, staying asleep, and waking up early in the morning. It also checks for unhappiness, problems with the day functioning, being able to notice sleep problems, and the stress that sleep problems cause. On a 5-point Likert scale, 0 to 4, each item is scored, given a total numbers from 0 to 28. Higher results mean the insomnia is worse. With Cronbach's alpha values usually above 0.9, the ISI has great internal consistency. It also has a good cross-validity, which means it strongly correlates with other sleep quality measures. A score of 10 on the ISI has been shown to be very good at finding people with insomnia in the general population of 86.1% and very good at finding people who don't have insomnia of 87.7%. The ISI is used a lot in both studies and clinical situations to check for sleepiness, figure out how bad it is, and to see how well the treatment is working. The impact of assessment data. Assessment data is very important for making treatment decisions because it helps find specific sleep problems and creates unique treatment plans based on each person's need and preference. Using tests like the PSQI and ISI, doctors can set standard measurements of sleep quality. It lets them see how well the treatment is working over time and make changes as needed. Using measurement data in a professional practice has been shown to improve the accuracy of evaluations, which leads to more effective and focused treatments for sleep problems. In study settings, survey data is very helpful to find out how common sleep disorders are and what factors are linked to them. This helps us learn about more biopsychosocial causes of these disorders. By collecting and analyzing assessment data in a planned way, healthcare professionals can see how treatments work. This helps them make a future clinical standards and policy decisions about sleep health. Overall, using measurement data in both clinical and study settings leads to more evidence-based ways of treating sleep problems, which improves patient results and quality of life. All right, case study. 45-year-old woman came in because she had been having trouble sleeping, waking up too often, and being tired during the day for about 6 months. The patient filled out the PSQI, and the results showed that she had bad sleep, with an overall score of 14. Also on the ESS was used over time. 10 on the scale means mild to excessive daytime tiredness. The doctor thought the patient might have insomnia, but based on the complaints and the results of the PSQI and the ESS, they suggested cognitive behavioral therapy for insomnia or the CBTI as their first treatment. The patient took the sleepiness, the ISI, after 8 weeks and 8 weeks of CBTI and saw that their score went from 18 to 8, which means that their sleepiness complaints got a lot better. The patient shows how measurement tools can help with identifying sleepiness, choosing the right treatment, and keeping track of how well the treatment is working over time. Treatment. There are different ways to treat sleep problems, such as CBTI, drug treatment, or the mix of two. People think that the CBTI is the best way to treat chronic sleepiness because it targets the underlying mental and behavioral issues that cause sleep problems. Studies have shown that CBTI works just as well as sleep aids in the short term, up to about 3 months, and better in the long term, more than 3 months, and there's no chance of side effects or a habit. CBTI usually uses a mix of methods such as limiting sleep, controlling stimuli, cognitive restructuring, calm training, and teaching people how to sleep well, depending on the person's needs. Internet-based CBTI has been shown to be successful and easy to use option to face-to-face treatment, especially in the places where the CBTI practitioners are hard to find. Medication can help with sleepiness for a short time, but it is usually suggested to be used along with the CBTI because of the long-term effects and better when both are used together. The challenges in treatment. Up to 85% of people who have sleep apnea are not identified or treated because they cannot get trained sleep medicine doctors or sleep centers. Not enough insurance coverage. High out-of-pocket prices for treatments for sleep disorders can be a big problem for many people. Sleep problems are still shrouded in myths and shame, which makes people less likely to report and get help. To 34% of people of obstructed sleep apnea don't follow through with their continuous positive airway pressure or their CPAP treatments. Problems with the device like masks, air leaks, skin irritation can make it harder for people to stick with the CPAP. People with sleep disorder may also find it hard to remember, take their meds, or follow their treatment plans because they're just too sleepy during the day. Future directions and research. One new area in the study sleep disorders is precision sleep medicine, which makes treatments more effective by adapting to each person's unique biological, psychological, and social factors. Wearable tech and mobile health apps are getting better, which makes it easier to keep an eye on the sleep habits and their circadian rhythms all the time. It gives researchers and doctors more useful information. Biomarkers, light exposure, and noise in the surrounding areas are getting more attention as factors that help sleep quality. It is important to look into the psychological and social parts of sleep, like how stress, social support, culture views of sleep affect people in order to come up with the complete training plans. Sleep experts and technology marketers need to work together. Conclusion: a biopsychosocial strategy is important in understanding first treatment sleep disorder because they are complicated conditions that affect by a mix of biological, psychological, and social factors. Using approved tools like the PSQI, ESS, and ISI to do a full review of sleep problems gives us enough information to help us diagnose, choose treatments, and keep track of how well they're working. When used together, the evidence-based treatments like CBTI and medication can help people with sleep problems and improve their quality of sleep. To learn more about how sleep and biopsychosocial factors affect each other, future studies should focus on combining measurements, smart tech, and mobile tech. It is very important to get rid of the things that make treatment less effective, like not being able to see experts, not having enough insurance coverage, and lingering myths. Make people more aware of the sleep problems to find a better ways to avoid them and give them the best care for them. We need a broad and diverse approach that includes healthcare professionals, academics, lawmakers, and everyone else. All right, and these are the references I use. All right, I appreciate your time. Thank you.